So what I'd like to talk about today is a relapse prevention plan, and in particular the stages of relapse. Relapse is often described as a process, not an event. So in order to understand relapse prevention, it is important to understand the stages of relapse. So relapse can start days, weeks, or even months before the event of a relapse itself. There are three stages of relapse: emotional, mental, and physical. In emotional relapse, there is no thinking about using, but the emotions and behaviours are setting a person up for a possible relapse in the future. The signs of emotional relapse are anxiety, intolerance, anger, defensiveness, mood swings, isolation, not asking for help, not going to fellowship meetings, poor eating and poor sleep habits. The signs of emotional relapse are similar to the symptoms of post-acute withdrawal. The more a person understands about post-acute withdrawal, the easier it is to avoid relapse at this stage. The earlier it is recognised, the easier it is to pull back from. In the later stages of emotional relapse, the pull of relapse gets stronger and the sequence of events moves faster. Relapse prevention at this stage means becoming aware that you're in emotional relapse and changing your behaviour. Become aware that you're isolating and make a commitment to attend fellowship meetings and ask for help. Recognise that you're experiencing anxiety and practice relaxation techniques. If your sleep and eating habits are backsliding, practice self-care by avoiding caffeine and sugars. Ensure you'll eat healthy throughout the day alongside practicing healthy sleep hygiene. If you don't change your behaviour at this stage, you'll live too long in the stage of emotional relapse and you'll become exhausted. This is when you'll experience tiredness and vulnerability and you will want to escape, which will move you into the stage of mental relapse. The most important thing you can do to prevent relapse at this stage is to take better care of yourself. In mental relapse, there's a fight going on in your head. Part of you wants to use, but part of you doesn't. In the early phase of mental relapse, you're just thinking about using. But in the later phase, you're definitely thinking about using. The signs of mental relapse are thinking about people, places and things you used with, glamorizing your past use, lying, hanging out with old using friends, fantasizing about using, thinking about relapsing, and planning your relapse around other people's schedules. It's harder to make the right choices as the pull of addiction gets stronger. So some of the techniques for dealing with mental urges. Play the tape through. When you think about using, the fairy tale is that you'll be able to manage your using this time. Play the tape through. One use-up usually leads to more use-ups. The feeling of disappointment may cause feelings of shame and resentment, and in turn a vicious cycle of continued using. When you play the tape through to its conclusion, using doesn't seem so appealing. A common trait is that you can get away with using, as no one would know if you relapse. Say for example your partner's away for the weekend, or you're away on a business trip. Your addiction will try to convince you that you don't have an issue. Remind yourself of the negative consequences you've already experienced and the potential of the yet consequences if you use again. If you can control your use, you would have done it by now. It is important to tell somebody that you're experiencing cravings. Speak to a supportive friend or someone in recovery. Share with them what you're going through. The magic of sharing is that the minute you start to talk about what you're thinking and feeling, your cravings begin to disappear. They don't seem quite as big and you don't feel quite as alone. Try to distract yourself. When you think about using, try doing something to occupy yourself. Call a friend, attend a fellowship meeting, go for a walk. If you just sit there with your cravings and don't do anything, you're giving your mental relapse room to grow. Waiting for 30 minutes is one way to further support yourself with not using. Most cravings usually last for less than 30 minutes. When you're experiencing cravings, it can feel like an eternity. But if you keep yourself busy, it can help the process of alleviating the craving to use. Do your recovery one day at a time. Try to not think about whether you can stay abstinent forever. That's a self-defeating thought. It's overwhelming, even for people who've been in recovery for a long time. One day at a time means matching your goals to your emotional strength. When you feel strong and you're motivated to not use, then tell yourself you will not use for the next week or so. But when you find it difficult and having lots of cravings, and those times may happen when you least expect them. Tell yourself that you won't use for today or for the next 30 minutes. Do your recovery in small chunks and don't sabotage yourself by thinking too far ahead. Make relaxation part of your recovery. Relaxation is an important part of relapse prevention because when you're tense, you tend to do what's familiar and wrong instead of what's new and right. When you're tense, you tend to repeat the same mistakes you made before. When you relax, you are more open to change. Once you start thinking about relapse, if you don't use some of the techniques mentioned, it doesn't take long to go from there to physical relapse. Driving to the liquor store, driving to your dealers, it's hard to stop the process of relapse at that point. That's not where you should focus your efforts in recovery. That's achieving abstinence through brute force. But it is not. If you recognize the early warning signs of relapse and understand the symptoms of post-acute withdrawal, you'll be able to catch yourself before it's too late.